Osteoporosis is bone loss, loss of bone strength, loss of bone quality that will promote or can lead to multiple fractures. We have found that in the past we didn't really screen for osteoporosis unless a patient had a fracture. Now we are trying to stay ahead of that thought and screen before a patient fractures. Hip fractures have a really high mortality rate of 30 to 40% mortality within the first year after a fracture. This is very dangerous, it's very cost consuming for Medicare, and these are things that possibly we can prevent if we get a patient before these fractures happen. So this is very important. Not only we teach prevention measures that can help prevent bone loss, also things that can help build bone loss and help increase the strength and quality of the bone. Osteoporosis is far more common in women than in men. However, there are men that are in our treatment program at this time, and men, it's not exclusive to females. Most people think of osteoporosis as the elderly lady that is walking as she is stooped over. However, at that point, osteoporosis is probably very far advanced. So a lot of patients say to me, I don't have symptoms. Well, you're not going to have symptoms until you fall and break something. So that's why the program has been started, and that was our main goal, is to stay ahead of that 8 ball, if you will, and try to treat the patient before they become symptomatic. Once you're symptomatic, you already have the disease process, and it's going to be a lot harder time trying to slow down that disease process. The osteoporosis program at the Orthopedic Center here in Easton is accepting new patients. We are looking to identify patients at high risk for osteoporosis, patients that have had previous fractures, especially above the age of 50. We want to get them in and get them identified, get DEXA scanning, get blood work, and initiate treatment as soon as possible to prevent any further complications in the future. We want to see any patient that is at risk for osteoporosis, any patient with family history, any patient that's been on long-term steroid therapy, any patient that's had previous fractures above the age of 50, or any patient that is aware of the fact that they already have osteoporosis. If a patient is diagnosed in the early stages of osteoporosis and treated appropriately, they can lead a normal life. The big area that we focus on is education, fall precautions, and prevention of any further injuries or trauma to the bone. We focus on bone building techniques, bone medications and how they work, the risk benefits of the medications, and discuss with patients what would be the best plan of action for their individualized case.